Brain is very important structure, and B need continuous blood supply in the brain. So there are many arrangement. So I will give you an example how the brain arranged very properly. Suppose we are living in the home, and in our home there are 6 rooms. The room number 1, the room number 2, the room number 3. The 3 room on the other side. The room number 1, the room number 2, and the room number 3. So this is the front side, okay? The front door is here. And this is the back side. And how many room? Total 6 room. So now the every room is independent. Like we are seeing in the hotels, every room is independent. In the every room there should be water supply, there should be electrical supply, there should be all the supply in the each and every room. So in the same way, in this each room we need every supply, each and everything, all the supplies. So one pipeline is coming here and one pipeline is coming here. So one pipeline is coming in the front side, one pipeline is coming on the back side, because we have to supply the water. So this pipeline is supplying this room as well as this room. So the water is going in this room as well in this room. In the same way, one pipeline is coming and supplying this room. So now all the 3 rooms having proper supply. In the same way, the 3 rooms are here. So for these 3 rooms also we are having one pipeline here, one pipeline here. So this pipeline is supplying this backside room, and this pipeline is supplying these 2 rooms. Same like the front side, even the back side. So if we talk about the brain, brain is same. In the brain we are having the anterior part of the brain. So this is the brain. In the brain we are having anterior part of the brain, middle part of the brain, and the posterior part of the brain. So we can divide in 2 parts. One in the right side, one in the left side. Brain is exactly the same. So this is the anterior part of the brain, this is the middle part of the brain, and this is the posterior part of the brain. So the one pipeline is supplying these 2 parts, and one pipeline supplying this part. So this is called internal carotid artery. The internal carotid artery is supplying the anterior part and the middle part, and the vertebral artery is supplying the posterior part. So with the help of 2 arteries, we are having full supply of the brain. Okay. In the same way, this other side also coming one pipeline, that is internal carotid artery, one branch going in this brain and one branch going in this brain. Okay. So the branch who is supplying the anterior part called anterior cerebral artery. The branch who supply the middle part called middle cerebral artery. The branch who supply the posterior part called posterior cerebral artery. Okay. In this way, we are having blood supply of the brain on both the sides. So let's try to make in a again simple way. So let's see here. So this is the internal carotid artery. The internal carotid artery dividing in two branches. The branch one is called anterior cerebral artery. The branch number second is middle cerebral artery. Okay. In the same way, other side, this is the suppose this is for the left side. In the right side also there is a one big artery coming, that is internal carotid artery. It is also dividing in two branch. Anterior cerebral artery and the posterior cerebral artery, because this is both the side. Now on the back side, so you look at here, the one internal carotid artery going from here, one internal carotid artery going from here, and dividing in two part. One is supplying anterior part and one is supplying middle part. So the anterior and the middle part supply by the internal carotid artery, and another is the vertebral artery who is coming and supplying the posterior part of brain. Yes. Okay. So the same thing I will show you in one image. So now in the same way, so suppose this is the brain. Let's make this is the brain. This is the middle cerebral artery. So middle. So the anterior cerebral artery supplying the anterior part of the brain. So this is the anterior part. The middle cerebral artery supplying the middle part of the brain. So this is the middle part. Now, I told you the two vertebral artery, they are coming and supplying the back part of the brain. So they are coming like this, and before supplying they become bun. Okay, so this is the vertebral artery who supply the posterior part of the brain. So when the vertebral artery getting fused, let's make again here. So vertebral artery getting fused together, and it's becoming the artery. The name of this artery is basilar artery. Then it's supplying the posterior part of the brain. Okay, so this supplying the posterior part. So when it supply the posterior part of the brain, so that is called posterior cerebral artery. Yesterday I told you this is supply 80% part, the internal carotid artery, and this basilar artery supply 20% part. So that's why we are telling it together vertebrovascular, vertebrobasilar system. Okay, on the back side. In the front side, it is called carotid system. Okay. Same thing I will show you in one image. So from the heart, so this is the heart. The heart is pumping the blood through the aorta. Aorta means the biggest artery. बहुत मोटी पाइपलाइन जिसे हम एओर्टा कहते हैं. Heart is pumping the blood. So this is the part which is called arch of aorta. Arch of aorta. From there, three branches coming up. यहाँ से तीन branches ऊपर आती हैं. 1, 2, and 3. So now let's see here. The one branch is this. Who is going on the right side? Brachiocephalic trunk. So this is the branch number 1. What's the name? Brachiocephalic trunk. Going on the right side. Then branch number 2, internal carotid artery. Sorry, common carotid artery on the left side. So this is on the left side, left common carotid artery. This is the branch number 2. And this is the branch number 3, subclavian artery. So three branches coming upward from the aorta we discussed yesterday. Okay, then, so on the left side we are having common carotid artery, subclavian artery, and they are the main artery who will supply the brain. So these are on the left side. But on the right side we are having brachiocephalic trunk. This is a brachiocephalic trunk. Now it will divide into part. Subclavian artery, same like here. Whatever here, it will same here. Subclavian artery and common carotid artery. So yesterday we already have discussed, so you already know that. But I am revising so you will understand. Then yesterday we discussed. Suppose we take the example of left side. In the left side, common carotid artery, supplying 80% brain. And from the subclavian artery, there is a one branch going upward. It will supply 20% of brain. The name of this artery is vertebral artery. Sometimes we are bending the neck to the back side and we are feeling dizziness. Suppose I am bending my neck to the back side and I am feeling dizziness, it means there is a compression on the vertebral artery. So when we do chiropractic now, sometimes you have seen chiropractic, we are adjusting the bone, or we do osteopathy. We check vertebral artery. If there is a compression in the vertebral artery, then we are avoiding the chiro. So there is a test. Okay, there is a test. We are telling the patient to take the neck to the back side, and person start getting dizziness or some other problems. It means this vertebral artery having compression. We can't do adjustment like this. Jerky treatment we cannot do then. We can do some smooth treatment. In the osteopathy, there are too many smooth treatment available. But if the vertebral artery is compressed and someone is adjusting the bone and doing chiro, person might get some harmful effect. So those who are very expert chiropractors, osteopaths, whenever they do the neck jerk, they first check the position, the condition of vertebral artery. Okay. So one is the front side artery, that is carotid, and one in the back side, that is vertebral artery. The carotid artery also very important here. So there's a front side, this is the artery, carotid artery. The carotid artery is dividing in two branches. Internal branch going in the brain, external branch going some outside. So internal branch, that is going in the brain, internal carotid artery. So now look at here. This is the Adam's apple. From the Adam's apple, we can see some protruder part here. Elevated protruder part. We can see more in the male, this Adam's apple. If we follow the Adam's apple and go in this side depression, this is a very important point in the acupuncture. Also, the name of this point is stomach 9. And this is one of the great points for high blood pressure or the hypertension, because from here we are be able to access carotid artery. So when we are doing the acupressure here, we will able to balance the blood pressure because we are working on carotid artery. So when the carotid artery is going up, it's like we have seen the wire. When wire is going up, wire के चारों तरफ covering होती है. Wire also having some covering. Wire is not going naked in our home. Wire having covering. Suppose this is the wire. Suppose this is the pen. Inside the pen, I will insert 3 wire. Suppose this pen is bigger, and inside this pen, I am putting 3 wire. 1 wire, 2 wire, 3 wire. 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 So here there is a one sheath, and inside the sheath there is a carotid artery. So when we are pressing the stomach 9 point, we are working on this carotid sheath. Inside the carotid sheath, we are having one artery, one vein, one nerve. Because everything we need in the brain, we need artery, we need vein, we need everything. So we are having one artery, that is carotid artery, one vein. Vein will be discussed after completion. The artery will be discussing vein, because we have to do the lots of cleansing using the brain. Veins. Vein means having impure blood. So one artery, one vein, one nerve passing from here. I will show you this. If you are pressing this point is very good for blood pressure. Why? Because here we are having some baroreceptors. Baroreceptor means some receptors who control brain, who control blood pressure. I will show you. So in this image, you can see here. So we can see here this pipeline. Can you see this pipeline type structures here? In this pipeline, there is a one artery. I told you common carotid artery, and one vein, internal jugular vein, who is bringing blood back, and one nerve that is called vagus nerve, 10th nerve. So it's become very important point here. Let's see the other image here. Now look at this image. So now we can see here CCA means common carotid artery is passing. Okay, from here. Then when this blue vein is passing, that is internal jugular vein. And one nerve is passing, that is vagus nerve. Let's see here. So common carotid artery, internal jugular vein, and vagus nerve. Three structure passing from here, and when you are pressing this point, which point? Stomach 9. Exactly at the level of Adam's apple, you are going and pressing this point. We are pressing the carotid sheath. Here we are stimulating vagus nerve. Vagus nerve is the nerve who relax our system. Vagus nerve, who is relaxing body and mind. That is the 10th cranial nerve, vagus nerve. Then common carotid artery, who is supplying blood to the brain. Then internal jugular vein, who bring deoxygenated blood from the brain. So we can stimulate this point. Okay. And this is called carotid sheath at the level of Adam's apple. Right? So now so look at now here. So this is the right common carotid artery. This is the left common carotid artery. Then it's dividing into branch. External and internal carotid artery. Internal carotid artery going in the brain. The internal carotid artery supplying anterior part and middle part. That is supplied by internal carotid artery. Anterior part. So in the anterior part there is a branch, anterior cerebral artery, and the middle part there is a branch, middle cerebral artery. Okay, so we have to remember this. So now we can see here There are two internal carotid artery, one on the left side, one on the right side. So this is on the right side, right internal carotid artery, who is supplying right side brain, and this is the left side, left internal carotid artery, who is supplying left side of the brain. Okay, fine. So now, if we are going on the back side, so there is a subclavian having one branch, vertebral artery, who is supplying the back part of the brain. Now I say very properly. So right vertebral artery, left vertebral artery, both uniting together and making basilar artery. That's why it's called vertebrovascular system. Okay. Now it will go in the brain. Now it will supply the brain. Okay. अब ये ब्रेन में जाएगी और ब्रेन को सप्लाई करेगी. चलिए इतना तो क्लियर है. अब मैं आपको एक इसमें बहुत ही महत्वपूर्ण चीज बताने वाला हूं. बैकअप सिस्टम ऑफ द ब्रेन. बैकअप सिस्टम ऑफ द ब्रेन कि क्या होगा अगर वर्टिबल आर्टरी में ब्लॉकेज हो गया तो क्या पोस्टीरियर पार्ट डैम डेड डेड हो जाएगा. If there is a blockage in the internal carotid artery, so there will be death of the anterior part. Body is having many arrangement. So now there is a one very wonderful backup system in the brain. And I will tell you, do you know anterior cerebral artery, middle cerebral artery, posterior cerebral artery, the most common bleeding happening in the middle cerebral artery. Most common side of the, when we see the report of the patient, or this patient having suffering with the problem of the, there is a bleeding, there is a rupture in the middle cerebral artery. Most common side of the bleeding, rupture, and which is creating paralysis or some other problems, that is middle one. Okay, there might be a problem with the anterior one, middle one, posterior one, anywhere. Now we are going to discuss a very wonderful system, that is the backup system of the brain. What is the backup system? So just come back to our home. This is our home. I told you, this is the anterior part of the home, this is the middle part of the home, and this is the posterior part of the home. Same, this is the anterior, this is the middle, and this is the posterior part of the home. And we have did the comparison with the brain. So we can consider the anterior part of the brain, middle part of the brain, posterior part of the brain. The anterior part of the brain is having blood supply from the anterior cerebral artery. The middle part of the brain is having supply from the middle cerebral artery. Okay. Same on the other side. This is the anterior cerebral artery. And this is the middle cerebral artery. Now, I have one question from you. Suppose there is a blockage here, or maybe blockage here, anywhere. Then there is a no blood supply here. चलिए घर से समझिए, आपके इस घर रूम में पानी नहीं आ रहा है, ब्लॉक हो गया पाइपलाइन. आप कहां से पानी लोगे बताइए. कहां आ रहा है, कहां से पानी लोगे? टेल मी. From where you are going to take the water? सिंपल, थिक सिंपल. बाजू वाले रूम से पानी ले सकते हैं कि नहीं ले सकते? भाई सिंपल सी बात है. If you are not getting the supply here, so we'll take the water from here. So now we are connecting both. Sometime here, right side poor blood supply will take from the left. Sometime left side poor blood supply will take. This is called backup system of brain. So there are one artery who is connecting both anterior cerebral artery. This is called anterior communicating artery. So what is anterior communicating artery? Anterior communicating artery, the artery who is connecting right side with the left side. Who is connecting right anterior cerebral artery with the left anterior cerebral artery? थिंक सिंपली. जब ये बड़े बड़े नाम आते हैं तो बड़े कंफ्यूजन हो जाते हैं, लेकिन कितना सिंपल सा है कि भैया इस रूम में पानी नहीं आ रहा, इधर से ले लो. ये इसी को कहते हैं बैकअप सिस्टम. आपके घर में पानी नहीं आ रहा, आप पड़ोस में से ले आओगे, भाई एक बाल्टी पानी दे दो. ऐसे ब्रेन भी करता है. इधर ब्लड नहीं आ रहा, इधर वाले से एक बाईपास बना के ले लो. When you are creating the bypass, it is called communication, communicating artery. Is it clear or not? एक कम्युनिकेशन और होगा बस. तो ये हमारा हो गया. अब हम एक कम्युनिकेशन और बनाते हैं. तो देखिए, हमने ये कम्युनिकेशन जो तैयार किया, वी आर हैविंग थ्री रूम हियर, थ्री रूम हियर. Here blood is coming. Here also blood is coming. Right? But we have created one extra branch for backup. Okay. Here blood is also coming. Okay. This is the posterior cerebral artery. Got it? Now, if there is a blood is not coming in this part, in the anterior part, we can also take the blood from posterior part. यहां से भी तो ले सकते हैं भाई. तो बस इतना ही समझाना था, बस और कोई नहीं. So this is called posterior communicating artery. The posterior communicating artery means from the posterior cerebral artery you are taking the blood and putting in the middle one. This is the middle cerebral. इसी को कहते हैं बैकअप सिस्टम ऑफ द ब्रेन. बस इससे ज्यादा कुछ नहीं बताना. आई विल नॉट कंफ्यूज यू टू मच. अब चलिए, अब मैं आपको इसकी एक बहुत ही शानदार इमेज दिखाता हूँ. लेट्स सी द इमेज हियर. अभी तो जो लोग बच्चे स्कूल में पढ़ते हैं ना, वो इसको खूब पढ़ते हैं. अभी आप तो सब बड़े हो गए हैं, तो फिर ये देखिए, ये सिस्टम है. दिस सिस्टम इज कॉल्ड सर्कल ऑफ बिलस. सर्कल ऑफ बिलस. ये जो कम्युनिक, अब देखिए, इतना में डायरेक्ट आप देखोगे तो बड़ा कंफ्यूज हो जाओगे. इसमें यही सब है. मैं आपको एक और बता देता हूँ. ये समझना इसलिए जरूरी है कि हमारे पास जब पेशेंट आता है कोई कंप्लेंट लेकर, तो उसमें लिखा रहता है कि इसको कहां पर रुकावट है, वेयर द पर्सन इज हैविंग ब्लॉकेज. सो वी शुड अंडरस्टैंड एंड अकॉर्डिंगली वी कैन मेक द ट्रीटमेंट प्लान. अच्छा, यहां पर प्रॉब्लम है। ओके ओके। अगर इस आर्टरी को ओपन कर दें तो थोड़ा सा ठीक हो सकता है। So let's see here in this image. So this is the vertebral artery of one side. This is the vertebral artery of other side. Both together make becoming the basilar artery. This is the basilar artery. Okay. So vertebral artery on the right side, vertebral artery on the left side, both together becoming the basilar artery. Then one branch going in the right side, one branch going in the left side of the brain and supplying the posterior part of the brain, and it is called posterior cerebral artery. So ये posterior supply हो गया। ये posterior supply करना इसका जिम्मा था। लेकिन यहां से एक बाईपास रूट बना लिया गया है। दिस इज द बाईपास रूट एंड दिस बाईपास ब्रांच इज गोइंग एंड मीटिंग विद द एंटीरियर सिस्टम। इस यहां लिखा है पोस्टीरियर कम्युनिकेटिंग आर्टरी। दिस इज द बाईपास और बैकअप सिस्टम। ओके। So this bypass branch is going and meeting with the middle cerebral artery. So if there is a poor blood supply in the anterior part, the blood can go from here. So middle cerebral artery and this is the anterior cerebral artery, और इन दोनों के बीच में एक ब्रांच है ऐसे देखो, इन दोनों को मिला रही है एंटीरियर कम्युनिकेटिंग आर्टरी। ये आपका होमवर्क होगा, आज आपको ये डायग्राम बनाना है और ग्रुप में भेजना है, क्योंकि एक दो बार बनाओगे इतना आसान लगेगा यार ये बात ही। इसे कहते हैं सर्कल ऑफ बिलस, द बैकअप ऑफ द ब्रेन। इफ यू आर अंडरस्टैंडिंग दिस, definitely it will take little effort because all the words are very new, but once you understand, wow, you will be able to read the reports. In the reports you should know three things: number one, arteries; number two, vein; number three, some spaces. In the spaces there is a CSF. If you know three things, you will quickly understand, okay, okay, what is the meaning of this report. So in this way, what is circle of Bilus? The circle of Bilus is the backup system of the brain, and we are connecting some structures of the brain. So चलिए इसके बेस पर मैं आपको एक क्विज देता हूं, कितना समझ में आया ये क्विज से, और you will able to understand little more with the help of this quiz. क्विज में डाल रहा हूं ग्रुप में और चैट बॉक्स में. So there is a group number 1, cranial osteopathy. I have put the quiz. Number 2, final group, where all the enrolled participant is there of the cranial osteopathy. I am putting the quiz there. Number 3, I am putting the quiz here in the chat box. Okay, also I am putting the quiz for premium group participants. Okay, so 3 places. And let's put the quiz here in the chat box. I'm giving you 10 minutes. Start now. So, done? Quiz over? Okay, so let's discuss the quiz. So let's write the name, Kumar Sharma, phone number. Question number 1, what is the main function of circle of Willis? Pump blood to the brain, act as a collateral circulation system. Collateral means Here one branch, who is connecting the two branches. Control blood pressure, supply oxygen to the lungs. So answer will be collateral system. Question number 2. Which two major artery provide blood supply to the circus of Willis, vertebral and the internal carotid artery, subclavian brachiocephalic, external and internal carotid artery, common carotid and the basilar artery. So answer will be there are two arteries coming in the brain, vertebral artery and the internal carotid artery. They are supplying the brain. So answer will be this. You also can unmute and you can tell. If you know the answer, please unmute and tell. The question number 3. The anterior cerebral artery primarily supply which part of the brain? एंटीरियर सेरेब्रल आर्टरी हमारे ब्रेन के किस पार्ट को सप्लाई करती है? व्हाट द आंसर?
B. Medial portion. Medial portion.
So the
Medial
medial portion of frontal, here the main focus is frontal and the parietal lobe. So we know the anterior cerebral artery is supplying the frontal and the parietal. Question number 4. Which artery is most common sites for the ischemic stroke?
Middle cerebral.
So the middle cerebral artery getting more ischemic stroke. Question number 5. The anterior communicating artery connect which two arteries?
Anterior cerebral.
C.
So the answer will be C. The two cerebral arteries are connected by the anterior communicating arteries. Question number 6. What is the role of posterior communicating arteries? So number 1, connect the
B.
vertebral artery with the basilar artery. No. Connect the
B.
internal carotid artery with the posterior cerebral artery. Okay. So it might be little confusion, but don't worry, we will be discussing little more. So answer will be B here.
B.
So posterior cerebral artery and the internal carotid artery, they are connecting each other. So no problem. This question might be little confusing, but slowly we will understand. The middle cerebral artery supply which area of the brain? So middle frontal lobe, lateral frontal temporal parietal lobe, cerebral velum and base
B.
brain system, medulla.
B.
So lateral part is supplied by the middle cerebral artery. Question number 8. Which arteries supply the occipital lobe and the visual cortex?
Posterior cerebral.
Posterior.
Posterior is supplying occipital cortex and visual cortex, occipital lobe and visual cortex. Question number 9. The vertebral artery join together to form which artery?
Basilar.
Basilar.
It's making the basilar artery. Question number 10. Which artery enters the skulls through the carotid canal?
Internal carotid.
Internal carotid. B, sir.
So see, this is entering through the in the brain internal carotid artery. So let's submit here. Okay. So actually yesterday also some person told me that it's look like little complicated. See, I will tell you one thing. Even the medical student, when they are learning anatomy, in the first go they are not able to understand. They also have to revise. They also have to go through again, because this is anatomy, and you also have to listen first time, and you have to see the video once again. You have to make the notes, and you have to go through with the PDF. Then you will able to understand if it is new for you. The person who already studied, for them there is no issue. So just try to go with the flow, because if you really want to become a very good therapist, you should know anatomy very nicely, so that you can read the reports and you can understand. You should not dependent on others or what is the meaning of this report. Being the patient coming to you with some problem, the problem of the eyes, the problem of the paralysis, you're just making the protocol. Oh, what is the protocol for the right side paralysis? No, we have to know, we should know, okay, in which part of the brain there is issue, and we have to work on that part of the brain. So we will able to work on the body. Okay. So all the arteries, all the nerves, all the veins, and CSF, slowly, we will understand everything. You have to see all the videos every day. Otherwise, it will be very great burden if you see, okay, I will see all the videos after 15 days. It will become great burden. Okay, fine. So carotid artery and the cerebral artery not the same. They are different. And we have discussed in the yesterday class also. You see the video of yesterday, and today you will understand very clearly the carotid artery and the cerebral artery. So this is the carotid artery. Suppose this is the carotid artery, internal carotid artery, and the branch coming out from the internal carotid artery, that is cerebral artery, anterior cerebral artery, middle cerebral, in this way. So cerebral artery is the branch. Okay. Any question till now? Anyone is having? Yes, Bandana ji.
सर
Yes.
एक क्वेश्चन में आपने ऑप्शन 1 भी आंसर दिया था, तो वो ऑप्शन 1 क्या था फिर?
वो गलत है, वो मिस्टेक है। उसमें ऑप्शन 1 में कुछ नहीं लिखा है ना,
हाँ,
वो
कुछ भी नहीं
टाइप
लिखा।
लिखते समय थोड़ा सा वो रह गया। ओके
ओके,
ओके, डन, फाइन।
यस सर,
Okay, thank you so much.
थैंक यू
See you in the next class. Next class will be on
मंडे।
Monday. अब हमारी अगली क्लास मंडे होगी। चलिए,
थैंक यू
आपके
वेरी
पास बहुत अच्छा समय है। There are total 3 videos this week, and you can see these 3 video at least once more. Make the notes. I will give you one quiz maybe within 2 days.
राइट।
So maybe tomorrow. So if you see all the 3 video, the quiz will be very easy for you. If quiz is difficult for you, it means see the video again. Okay. And
So Monday will
the class
Monday
will
class
be
for
Monday.
all.
Yeah, Monday.
For
Yeah.
all.
8 class will be for all. So we have completed total 2 in the last week, 3 in this week. So total 5 classes completed. So next week 3 classes for everyone. Then
Okay.
after that the classes will be only for enrolled participants. Okay, fine.
गुड
So
नाइट।
let's close the session. See you in the next class. Good night.
गुड नाइट।